Weight control isn't just a problem for adults, it's an important part of raising children too. There's a line between making sure kids are well fed and overfed. Doug Johnson points out the problem of overfeeding toddlers in your child's health.
Parents have a lot to worry about as their children grow, including making sure they're happy, healthy, and safe. The healthy part is tricky. How parents feed their children can cause big problems. The American Heart Association says about 1 in 3 kids is overweight or obese. How kids eat and how much they eat is a habit parents influence from the start.
Parents are always worried about, am I feeding my child enough? Am I feeding them too much? First things I think parents should realize is that children are not going to willingly starve themselves. So usually you don't need to worry about if they're not eating. Don't make it a bigger deal. When they're hungry, they will eventually eat.
Figuring out young Jake's eating habits isn't always a sure thing for his mom. She started out thinking his meals needed to be set amounts, but quickly learned that that would depend on his appetite.
It varies from each meal. I've definitely realized that, and always used to think, oh, he has to eat the same exact at every meal and eat a good amount.
Now, there's an easy way for parents to visualize just how much food their toddler's stomach can hold. A toddler's stomach is no bigger than their closed fist. So a good rough estimate for feeding toddlers is 1 serving of food should equal 1 tablespoon for each year. 1 year, 1 tablespoon per serving. 2 years old, 2 tablespoons per serving, etc. That may seem different than many Americans' practices of putting more food on the plate than they actually need.
We typically give toddlers portions that are way too big for them to finish. They stop eating, you're trying to force them to eat, and realistically, they're full.
Forcing a child to eat can inadvertently create bad nutritional habits as they get used to eating too much. Doctors are seeing more children with problems related to unhealthy eating, including high blood pressure, diabetes, and high cholesterol. And obesity is also associated with increased risks for many types of cancer.
If you start out with too much, 2 things happen. 1, you inadvertently create bad eating habits because you kind of get them used to eating past the point that they're full. And you start training them early to kind of eat more than they really should be eating, which is a setup for childhood obesity later.
So pay attention to the signals a child sends about being finished with the meal so you don't overdo it.
Now he's a little more verbal than he used to be, so he'll more than likely say all done.
For Smart Medicine, I'm Doug Johnson.